What if the way you slept last night quietly added years of damage to your spine, your heart, and your memory, and you had absolutely no idea? Most people over 60 have been sleeping the same way for decades, and most of them are making at least one mistake that costs them their energy, their sharpness, and their comfort every single morning. Stay with me, because in the next few minutes, I'm going to show you exactly what those mistakes are and what to do instead, starting tonight. Sleep changes as we age. That's a fact. But what most doctors never take the time to explain is how the wrong sleeping position can quietly speed up joint damage, increase your risk of stroke, and steal the deep, restorative rest your brain needs to stay sharp. I'm Dr. Isabel Greer, and for over 10 years, I've worked directly with adults over 60, helping them move better, sleep better, and live better. I've helped hundreds of patients turn their sleep around, not with medication, not with expensive gadgets, but with simple, science-backed adjustments that anyone can make tonight. In this video, I'll walk you through 5 critical truths about sleeping positions for seniors, the ones that are harming you right now, and the ones that can genuinely transform your mornings. Quick disclaimer before we start: everything I share here is for educational purposes only. This video is not a substitute for personalized medical advice. Please always consult your own doctor before making changes to your health routine. Now, let's get into it. Let me paint a picture for you. You sink into bed, roll onto your stomach, arms tucked under the pillow, and finally, you fall asleep. Feels cozy, right? Like you've slept this way your whole life, so it must be fine. Here's the hard truth. After 60, it's not fine anymore. When you sleep face down, your head has to twist to one side for hours at a time. Think about what that means for your neck. You're forcing muscles, nerves, and blood vessels into an unnatural rotation for 7-8 hours straight, every single night. It's like slowly wringing out a towel that never gets the chance to unwind. I had a patient, I'll call him George, a 73-year-old retired electrician, who came to me complaining of constant neck stiffness, headaches every morning, and a tingling that ran down his left arm. He'd seen 3 different doctors. Nobody had asked him one simple question: how do you sleep? When he told me flat on his stomach, face turned left, every night for 50 years, I knew exactly what we were dealing with. The American Chiropractic Association has documented this clearly. Stomach sleeping in older adults is one of the leading causes of cervical misalignment, a gradual shifting of the neck vertebrae that doesn't just cause pain. It affects balance, coordination, and even circulation to the brain. And there's something else nobody talks about. When your chest is pressed into the mattress, your lungs can't fully expand. Your diaphragm is trapped. You spend 8 hours breathing shallowly, less oxygen to your heart, less oxygen to your brain. For someone over 60, that is not a small thing. That's what causes you to wake up foggy, tired, and stiff, even after a full night's sleep. George made one change. He stopped sleeping on his stomach. Within 3 weeks, the tingling was gone and his mornings were quieter. Not perfect, but dramatically better. If stomach sleeping is your habit, I know it feels impossible to change. But by the end of this video, I'll give you 2 positions that are genuinely comfortable and won't punish your body while you sleep. Keep watching, because the next one surprises almost everyone. We all did it as kids. Knees pulled up to your chest, curled tight, safe in your little bubble. It feels instinctive, warm, protective. But here's what I see in my clinic over and over again: older adults who sleep in a tight fetal curl and wake up with shortness of breath, severe morning stiffness, and a spine that's slowly rounding forward. When you pull your knees hard toward your chest and hold that position for hours, your diaphragm gets compressed. Your lungs have less room to expand. And for adults over 60, whose lung elasticity has already naturally decreased, this means your body is running on reduced oxygen all night long. The result? Chronic fatigue, morning headaches, a heart that works harder than it should while you're supposed to be resting. But the spine issue might be even more serious. I want you to imagine a garden hose. When it's straight, water flows freely. When you curl it tight, the flow gets restricted, and if you curl it the same way every day for years, the hose starts to hold that shape permanently. That's what happens to your spine in a tight fetal curl. Over time, it encourages the forward rounding we call kyphosis, that stooped posture you see in many older adults. It shortens the muscles along the back of your spine. It compresses the discs between your vertebrae. One of my patients, a lovely 67-year-old woman named Margaret, came to me frustrated. She said, "Isabel, I sleep 8 hours and I wake up feeling 90. She wasn't exaggerating. When I filmed a quick postural assessment, her spine had already developed a visible forward curve. She'd been sleeping in a tight fetal position her whole adult life. We worked together on repositioning, stretching, and pillow support. 6 weeks later, she told me something that stuck with me. I feel like I got 5 years back. You don't have to give up side sleeping. You just have to stop compressing yourself into it. A loose, supported side position, which I'll show you in a moment, gives you all the comfort with none of the damage." Are you still with me? If these tips are making sense, drop a 1 in the comments right now. It takes 1 second and it helps me know I'm giving you what you need.
For years, doctors said it. Flat on your back is best. Neutral spine. Perfect alignment. And in your 30s, that was probably true. But after 60, sleeping completely flat, head level with your body, no elevation, no support under the knees, can quietly become one of the most dangerous positions you choose. Here's the problem nobody explains clearly enough. When you lie completely flat, gravity pulls the soft tissues at the back of your throat, your tongue, your soft palate backward and downward. For many older adults, this partially or fully blocks the airway. The result is snoring, gasping, and a condition called obstructive sleep apnea. And sleep apnea is not just annoying. According to the American Academy of Sleep Medicine, untreated sleep apnea in adults over 60 significantly raises the risk of stroke, heart attack, and memory loss. Your brain is being deprived of oxygen, quietly, repeatedly, every single night while you sleep. I want to tell you about a patient whose story genuinely upset me when I first heard it. His name was Richard, 71 years old, sharp as a tack, proud of his health. His wife had been telling him for 2 years that he stopped breathing in his sleep. He laughed it off. By the time he came to see me, he had high blood pressure that wouldn't respond to medication, memory gaps that scared his family, and he was exhausted every single day despite sleeping 9 hours a night. His sleep study came back, severe obstructive sleep apnea, 34 interruptions per hour. And there's another issue with the completely flat position, acid reflux. Nearly half of all adults over 65 deal with some form of reflux. When your head is level with your stomach, gravity stops doing its job. Stomach acid creeps upward into the esophagus, burning the lining and disrupting sleep, sometimes silently, without you ever waking up fully. The fix is not complicated. It's elevation. And I'll walk you through exactly how to do it safely in just a moment. First, let's talk about the fourth position, one that fools people because it feels like a solution when it's actually making things worse.
I understand why seniors end up in recliners at night. Hip pain, back pain, acid reflux, arthritis. When lying in bed feels like punishment, the recliner starts to look like a lifesaver. But I need to be honest with you, because I care about your long-term health more than I care about telling you what feels comfortable to hear. Sleeping in a recliner every night is one of the most damaging habits older adults can develop. Here's why. The semi-sitting position of a recliner keeps your hips bent at a fixed angle for hours. This restricts circulation to your lower legs. Fluid pools. Ankles swell. In more serious cases, this sets the stage for deep vein thrombosis, blood clots that can move to the lungs. That's not a small risk. That's life-threatening. At the same time, the recliner's angle never lets your spine fully decompress. Your lower back stays under partial load all night. Your hip flexors shorten. Your core muscles weaken. And over months and years, this accelerates exactly the kind of balance problems and fall risk that steal independence from older adults. But the issue I find most upsetting is what happens to sleep quality itself. A recliner keeps you in light sleep. Your body senses that you're not in a fully horizontal, safe rest position, and it never fully lets go. You may close your eyes for 8 hours, but your brain and muscles never reach the deep, slow-wave sleep that repairs tissue, consolidates memory, and restores your immune system. You're technically resting, but you're not truly recovering. I had a patient, 76 years old, former schoolteacher named Dorothy, who had slept in her recliner for 2 years because of hip pain. When she finally came to me, she said, "I feel like my body is aging faster than my age." She was right. Muscle testing showed significant weakening in her core and hips. Her balance was compromised. And her sleep architecture, the pattern of deep and light sleep, was severely disrupted. We found her a proper wedge support system for the bed, worked with her on pillow positioning, and addressed her hip pain with targeted stretching. It took 6 weeks, but she got her bed back. The recliner is fine for an afternoon nap. It's not a bedroom. Your body deserves better than that. Now, let's talk about what actually works. I want to give you something practical. Something you can use tonight, not someday. Position 1, the supported side recline. Lie on your left side, not curled tight, gently extended, hips slightly open. Place a firm pillow between your knees. This one small adjustment keeps your pelvis level and takes the rotational stress off your lower spine. Use a pillow under your head that keeps your neck straight, not bent up, not drooping down. Your ear should line up with your shoulder. If your shoulder feels uncomfortable, slightly roll your top hip back, opening the chest a few degrees. This takes pressure off the shoulder joint without losing the spinal alignment benefit. Why the left side specifically? Research from the Cleveland Clinic shows that left side sleeping promotes better circulation to the heart and reduces acid reflux by keeping the stomach below the esophagus. It's a small detail that makes a real difference over time. This is the position I recommend most often for my patients dealing with back pain, acid reflux, or mild sleep apnea. It works for almost everyone. Position 2, the elevated back sleeper. If you prefer sleeping on your back, the key is elevation, not flatness. Raise your upper body by approximately 30 degrees. You can do this with a wedge pillow, an adjustable bed base, or even 2 to 3 firm pillows stacked carefully. Then place a small, soft pillow under your knees. This takes the lower back out of that flat, strained position and lets the lumbar spine relax completely. At 30 degrees of elevation, gravity becomes your ally. Stomach acid stays where it belongs. Airways stay open. The heart doesn't have to work as hard to pump blood upward. And your spine, finally, gets a full night of decompression. One of my patients, a 68-year-old woman named Sandra, tried this position after years of waking up coughing and exhausted. She sent me a message after the first week. It said, "I slept through the night for the first time in 3 years. I cried when I woke up." That's what the right support can do. Start with one of these 2 positions tonight. You don't need expensive equipment. A couple of good pillows and the willingness to try something new is all it takes. Let's bring it all together quickly. Stomach sleeping twists your neck, restricts your lungs, causes nerve damage over time. Stop it. Tight fetal curl compresses your diaphragm, rounds your spine, leaves you exhausted. Loosen it. Flat on your back with no support opens the door to sleep apnea, reflux, and oxygen loss. Elevate. The recliner as a bed blocks circulation, weakens your muscles, prevents real sleep. Get back to the bed. The 2 positions that help: supported left side with pillow between knees or elevated back with knee support. Try one tonight. Small changes, real results, starting tonight. And that's a wrap for today, friends. I'm Dr. Isabel Greer. If even one thing I shared today helps you wake up with less pain, more energy, or just a little more clarity tomorrow morning, then this was worth every second. If you found this helpful, please hit the subscribe button right now and turn on the notification bell. Every week, I bring you honest, practical, science-backed health advice made specifically for adults over 60. No complicated jargon, no scare tactics, just real information you can actually use. I'll see you in the next video. Until then, take care of yourself, be kind to your body, and remember, it's never too late to sleep smarter. Good night and good health.